What can be done about fixing a drooping bottom eyelid? Ever since I had malar implants removed, one eye is now a totally different shape than the other. One is tiny and does not open fully at the bottom lid, while the other is big and opens fully at the bottom lid. What caused this? Scar tissue? Did the doctor make an error? How can I fix this issue? It's really bothering me.
Thank you for your question. You state in your question that ever since you've had malar implants removed, that the overall shape of your eyes are different. And you describe in detail the difference between the two, and you provide a photo to support this. So certainly I can give you some guidance as to what your concerns are. This is, of course, in the absence of a physical examination. A little bit of background: I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Facial implants and cosmetic eyelid surgery is a very significant part of what I do. I do a lot of work in volume augmentation. These days, thanks to new fillers, there are a lot of more options. But to give you an idea of what I suspect you experienced pre and post the malar implant placement. First of all, malar implants or sub-malar implants, depending on the type, or combined implants, are basically placed through the mouth inside on top of the bone, the zygoma, the zygomatic arch, and the malar eminence, and it fills that space. Now, a lot of times when I see patients who come in consultations concerned about their outcomes, they'll have implants that are placed that may have caused the eyelid to pull a little bit, and sometimes they ask me to remove those implants. When I do these procedures on my own patients, I tend to be more conservative. I tend to put smaller to medium-sized implants. Now, that being said, there is going to be some potential shifting of tissue that may change, of course, after the procedure of explantation or removal is performed. I notice in a photo there appears to be a slight bruise under your left eye. So I think it's probably reasonable for me to conclude that you've had this procedure done relatively recently. If it's unrelated, well, that's fine. That's also that still can be potentially relevant later on. However, if your procedure was done where the implants were placed through the lower eyelid, well, then that has a different implication in terms of the disruption of tissue around the eye. When the procedure is placed where the implant is placed transconjunctivally, well, then that means that more eyelid tissue is disrupted, which means that scar tissue can be behaving in a slightly different way. Now, understanding all this, it is generally recommended to not do anything if the procedure of removal has been done relatively recently. To understand the wound healing process, then you can understand that there's swelling and bruising as well as continuous remodeling that's going on that can affect the position of the lower eyelids. That being said, seeing your doctor and having them examine your eyelids and look at the relative position, and if it's the same doctor who put in the implants, you can look at your pre-operative photos. A lot of times it's been an observation, and it's just normal human nature, you may not have realized that the eyes were somewhat asymmetric before the procedure, and now that you've had a procedure or two procedures, you're now looking at your eyes much more critically. Now, of course, there is going to be a certain allowable or natural asymmetry in the face, but certainly once everything is settled, you can probably explore options to surgically balance the eyes more favorably. But I would caution you about additional surgeries until things have settled down. It's very important not to operate too early and to also look in the context of how obvious something is. When I looked at your photos, certainly I understand what you're describing, but at the same time, it's not a significantly glaring type of asymmetry. Now that, of course, you'll probably disagree because these are your eyes and you know your face. I think go back to the original doctor who performed the removal of the implants and ask what can be done to help with this asymmetry. Sometimes it's just massaging and stretching the eyelid or doing things to help affect the remodeling process, or what's called during the wound healing phases when the body is going through something called tissue remodeling. So I think that you have options. I think you should really discuss these with your doctor to understand. No one understands the anatomy better than the doctor who actually performed the procedure. If there is a concern about your confidence, then of course meet with another doctor. From my perspective, a specialist such as an oculofacial plastic surgeon would probably be relevant because this is a very specific, specialized area of eyelid position. So I hope that was helpful. I wish you the best of luck, and thank you for your question.